Like I said, I'm not as entertaining as Corey. Maybe we're going to do basic first aid. Going to manage emergencies require calm and effectiveness to an approach of the situation. First thing is you want to protect yourself. Is the scene safe? Is this scene safe to go up on? Sure, why not? BSI. Always make sure that we have our body substance isolation before we go upon a scene. Standard precautions. Always use gloves no matter what. And if you ever come upon a scene when Tiffany's there, I'll be the one that always asks you, gloves? I always forget mine. Extra help. Always need to make a determination when you come upon scene if you need to call extra help. Usually the deputies are the first ones to get there. You guys usually make the determination, do we need to put a bird in the air? Gather as much detail as possible. You guys get to determine whether EMS should be activated. Easy assessment. What's the ABCs? Airway, breathing, and circulation. Open the airway. Make sure the airway is not blocked. Chest rising and falling. Use oxygen if it's available. Is the patient's skin color normal? Does the patient have a pulse? Control any immediate life threats and treat for shock. Emergency management. Be familiar with policies on management of emergencies. Perform only procedures in which you are trained. So if you're Lonnie, you stand back and scream. Have you ever been on an emergency with him? It's all he does. And usually he has gloves and he'll shake them. Touch it. Maintain certification of your CPR. Are you guys required to have CPR certifications? Maintain knowledge of first aid. So your types of emergency is medical, cardiac emergencies, chest pain, so sweating and diaphoretic, anxiety. Did you cut this down last time? It didn't work over there. Irritability. Abnormal blood pressure. Epigastric pain. Nausea and vomiting. Your upper gastric pain. And oh my goodness, feeling of impending doom. You're gonna die. Usually when you go on a cardiac arrest, they always ask you if you're gonna die. Never tell them yet. And never say no. We're going to get you help as soon as possible. Make your patient as comfortable as possible. Do not allow your patient to walk. Give them aspirin if possible. Assist the patient with nitro if it is prescribed to the patient. Make sure that you have gloves on before you touch the nitro because it will go through your skin and then you will have a headache. EMS. Fainting. Place the patient's supine on their back. Loosen their clothes. Don't strip and flip. Don't cut them off. A lot of people like to do that. Just because they faint doesn't mean they want to wake up naked. Apply cold washcloth to their forehead. Measure their pulse. Monitor their breathing. Poisoning. Important questions to ask. What substance is involved? How much? What actions have been taken? When did this occur? And patient's weight. Weight. How come the weight? Because it depends on how much they weigh on what poison control is going to tell you. So when you call poison control, that is one of the first things they're going to ask you. So what exactly they took and how much does the patient weigh, of what antidote they're going to have you. They have to give them milk, if they're going to do induced vomiting. This depends on the patient themselves. Poison control hotline. Bites and stings. History of bite, pain at the site, redness, swelling, dizziness, fever, chills, nausea, vomiting, stings, or marks at present. If the stinger is present, scrape with a blunt edge and remove. Avoid using tweezers. If it is a tick, don't pull it out with tweezers. They tell you to take a match and use the heat, and they'll pull it back. They'll pull their veins back. Use a credit card. Don't apply ice. Watch for the patient to have allergic reaction. Wash the area gently. Remove jewelry from any distal affected areas, just so you can make sure that if there's any swelling. Position the wound lower than the heart. Asthma attack, SI or SX. Pale or blue colored skin. 1 or 2 sentences. So, how do you tell if somebody's having an allergic reaction? Can you always tell if they're having an allergic reaction? Maybe. So my daughter's allergic to preservatives. She'll tell you that she's not having an allergic reaction, but if she has ketchup that's room temperature, her ears go bright red. And it starts to go down her cheeks, you have about 20 minutes to get Benadryl into her, or you're going to have to start her with an EpiPen. So you just get used to knowing the signs of each individual allergic reaction. You can help a patient with an inhaler as long as it is assisted or it is prescribed to them. If they do not have an inhaler, you just have to try to keep them calm until EMS gets there. Remove them from any area that is irritating them. Diabetic emergencies and treatment. Maintain their airway. Give them orange juice, and you can add 2 teaspoons of sugar to the orange juice if they say that their sugar is low. If they are unconscious, make sure that you activate EMS and you can't do anything. Don't try to give them anything. Diabetic emergencies, shakiness and weakness, slurred speech, diaphoretic, rapid pulse, respiratory rate rises, seizures are common in young kids. It's either low or high. Altered level consciousness. So they're either really high or they're really low. So some people function really well with low blood sugar. Some people are completely out of it. Seizures. Sudden change in sedation, behavior, or movement caused by irregular electrical activity in the brain. Patient care during seizures. Place the patient on the floor. Position the patient on the side. Why would you want to position a patient on the side if they're having a seizure? In case they throw up, and it also makes it so their tongue dislodges, so it doesn't fall back in the back of their throat, so it maintains their airway. Loose and restrictive clothing. Don't cut it off of them. We've seen that happen with an agency out in the field. For some reason, they like to cut close. Strip and flip is stuck in their light. Remove harmful objects from around them. Make sure that there's no chairs, tables. Just protect them from injuries and make sure that you don't hold them still. Protect their airway, positioning, suction if needed if they vomit. Do suction their airways. Ventilate if needed with a BVM. Treat injuries and activate EMS if seizure continues. Hypoxia, shivering, redness of skin, altered mental status, decreased motor function, slower heart rates, coma. So, if they're cold. If they're cold. There's no other way. Treatment. Remove the patient from cold. Remove wet clothing. You can strip and flip in this area. Warm passively. You don't want to get them warm fast. You want to move slow. Give lukewarm water if the patient can swallow. Do not give caffeinated drinks. This will stimulate their heart function and will raise their temperature too fast. Hyperthermia. So you'll give them muscle cramps, profuse sweating, flushed skin, masked thirst, exhaustion, nausea, vomiting, lack of sweating, and unconscious. If a person is sweating, if they are sweating, it is okay to give them fluids. If a patient is no longer sweating, do not give them fluids. Remove the patient from heat. Remove patient's clothing. Cool patient with wet clothes and fanning. If the patient is still sweating, give lukewarm, not cold water. If the patient is not sweating, do not give drink. Activate EMS. If they're not sweating, because their body's already started to shut down. So it's easier to do it intravenously. That way that their organs start to function at the same time. So there's types of emergent is traumatic. Medical we went over, so we're doing traumatic injuries. Bleeding. What kind of wound is that? Self-inflicted. That's just a surface one. Minor. So capillary bleeding is slow, no flow, road rash, no immediate life threats. The life threat would be for injections later. Is he here?
Yes.
Hey,
What?
get in here. This is your part. No. Hey, it's your turn.
No, I had it first.
No, I haven't eaten. It's yours. No, it's really yours. No, this is really yours. This is the fun part. Come on. They're so boring. Entertainers here now, so.
We've got to identify the bleeding. I don't know where the venous, the arterial, and the capillary bleeding. How do we identify arterial bleeding? That's the easy one. Spur. It doesn't just even flow. So venous flow. How does that look? What does it look like? It flows. It's going to be heavy. It's typically darker. Are they both deep? Can they both be like hurricane? Absolutely. We lose a lot of blood in a hurry for either one. Capillary bleeding. Anybody ever had road rash? Okay, that's capillary bleeding. It's just oozing. Is that typically life-threatening? No. Unless it's, you don't take care of it, you don't clean it, you get the infection in it, then it creates kind of a problem for it that way. Okay. Venous bleeding, go ahead. No comment. That one, keep going. Bleeding treatment. What do we do to take care of bleeding? Okay, direct pressure, first and foremost, that's how we do it. What do we say when we're talking about direct pressure? How do we do that? Okay. I grab a hold of his arm and hold tight, put something clean, sterile, preferably clean neck, whatever we got after that. But put that right over the wound, hold direct pressure on it. We can't sit and hold that forever, can we? So we're going to wind up wrapping it and putting something on it. So a dressing goes against the wound, the bandage goes around the dressing. When we start talking about those things, that's a little bit different. So, give me a clip, please. Okay, so clean the wound. What do we clean the wound with? No! No! Hydrogen peroxide is designed for one use, and that's inside the mouth. What happens when you pour hydrogen peroxide on a wound? It bubbles. What's creating those bubbles? Why is it bubbling? Heat, making a chemical reaction, right? And that causes tissue damage. So we don't want to put that on there. A lot of this stuff around the world. Every place I've ever been, I've found soap and water. Here's the good, mild soap and water. Scrub it a little bit. They make betadine, they make iodine, they make all these different fancy stuff. And my luck, I'm going to find out 1% of the population that's allergic to whatever I put on it, and then have a problem. Soap and water is probably the best thing you can do. Just nice, gentle scrubbing, clean it out. Okay? Apply a sterile dressing. That part goes over the wound, right? Direct pressure, that's what our bandage does. It flips over the top of it, or our hand on top of it. Elevate the wound. Show me elevation. With your feet. Everybody says, how high do I elevate it? We elevate it above the heart. So if I take your arm and I put it like this, how long can you leave it there? Till about that time I let go, right? So put it just above the heart. We have one other method that we use to control bleeding. Anybody violent guess what it is? No, before that, no. Tourniquets are making a pretty big comeback. They were kind of taboo for a while, but they're really, really popular now. Pressure point, indirect pressure. So you hit a pressure point. So a pressure point is basically anywhere where an artery goes over the top of the bone. So you can feel a pulse in it. This would be a brachial pulse. You can feel right there. That's a great pressure point for anything down this direction. What other pressure points do we have? Femoral, okay. Up field, nice kneecap. where you can feel a pulse and pressure point. You manage to put pressure there and see the stop or slow or stop the bleeding. Okay, let's practice. We're going to do what we call a bandaging rodeo. It's going to be fun. You're going to have to think him. What I want to do, I need a volunteer. Come up and start out with me or a volunteer, however you want to do it. Come on, I'll just show you what we're going to do. And we're going to get into Kingdom 2. And we're going to have a competition.
You put a hole in him first, like it's real.
Yeah, I got a pocket knife right here. Rules of engagement. I realize we have to explain that first. We'll wear gloves. We wear gloves, and you're not going to explain to it. It's not just, I'm worried about what you got, but you don't know what I can. If I'm going to be cleaning your wound or taking care of you, and you want to make sure that I haven't been up to the glove bag in the bed or not, all over, just like that, okay? Before you clean up this wound, okay, he's got a real nasty wound right there. So we talked about the first thing we did, we talked about direct pressure. I take this dressing, and I slap it on right here. So I motivate him to help me, help him. Okay? Hold that, or you're going to die. He's going to hold that. He doesn't want to die. These are my most favorite things in the whole world. Pressure dressing anywhere on your body. They call them triangles. I don't know why. But, they're probably one of my favorite things. So what I'm going to do is I'm going to take and I'm just going to do a short and wide for back. Take that. Right over the top of it. Underneath. I have to get it fixed down. I don't want that to move. He's got a light threatening bleed there, and it's dangerous, and I want to take care of it. Up here. Competition. I've seen this done in 10 seconds. We want to do it quick. We want to get it on, but we don't want to sacrifice quality. Move. Stay still. You guys do this. I'm going to come around and we're going to check it. So what we're going to do is we're going to walk through it all. Okay? You're going to put it on one, then we'll swap, and then we're going to have a little competition. Okay? Okay. Everybody grab the gloves of choice and move around the room. Clear up here. Glove up.
You need a partner? Is everybody, who doesn't have a partner yet? So you have a Brandon Palmer does not have a partner.
Who's your partner?
Okay. I did it.
Oh, that's right, you did. No, you did.
I was the winner.
Yeah, that's right.
Gee.
Hey, we're perfect. Yeah.
You are perfect.
Oh, we got.
We got it. Right.
I need one. Yeah. Everybody glove up.
Okay, Scott, that pain starts stirring on your legs. Spread
I'm scared.
Diane won last time.
We'll walk through it real slow and easy. That right there.
I had to do that.
Yeah. Hold that or you're gonna die.
They were split.
We need to make sure that all you officers have triangle batteries in your first aid kit. As much as I can. It's like triangle batteries.
Elevate. No.
You're gonna die.
Does it hurt?
Right.
Flex the core of it till it's done. Wait for patience, I'll get soup. Relax. You can flex it like a move. That's why you give the secondary
Yeah. Okay. You can practice with that.
Hold that or you're gonna die.
Yeah, that was nice.
I do have some shears. Oh, I don't.
Okay, Brad, we got two over here now. I was wondering.
Hi.
Yeah, nice. Full time. You want to get direct pressure, that knot right over the top of the wound. Okay. Yeah. Don't cross on bottom, right? I cross. Okay.
Wait.
Right this time? Double banded.
Oh, yeah.
Okay. Little competition going here. Little timed event. Little rodeo. Oldest you're gonna die, wrap it, tie it, elevate, time. Okay? And I will come check them after. Make sure they have to stay there. Otherwise you're at them. Let's get a little
I told you you'd a lot funner than I am.
on your mark! Get back! Go!